Hello, my name is Ava, and I was able to look at a patient that was 15 years old, and she was currently struggling with vertigo, fatigue. Her BMI indicated underweight as she was 107 as a 15-year-old, and was experiencing depression as well, loss of menstrual cycle, and then a test did show that this patient is positive for mono. So after looking at all of the patient's history and symptoms, I came to a conclusion that the underweight and overall not feeling well would be due to low energy intake, the lack of nutrients, and over exercising, because that was also listed that the patient does exercise a lot but isn't obviously getting their enough protein and nutrients in their diet to sustain that lifestyle. So that's what came to my decision. I think the best treatment is to first acknowledge the problem with the patient and to start a diet plan. It's really important to gradually go into something like this, especially with a patient that has, I think I forgot to mention this before, but she has a history of anorexia and bulimia, which are two eating disorders. And although it's in the past and it's not a current issue in the computer, eating disorders have, number one, a really easy way of coming back. It's really hard to fully recover from them, especially physically, even if you are starting to eat healthier and really focusing on overcoming an eating disorder. It can do so much on the loss of a menstrual cycle for a long time, just so much damage to your hair, your bones, your body. So it is important with any patient that does have eating disorder history to really take things gradually and slow with them and make sure they're very comfortable. For the diet that I created, I wanted to prioritize intaking calories, adding more calories to her diet. It would be ideal for 0.5 to a pound a week of adding weight on to her as she is underweight. Increasing protein is huge. And then for vitamins, vitamin D and calcium are two huge ones that I really wanted to increase to help the bone density of her, as she is feeling very brittle and underweight. And I added milk in the diet, calcium. I really wanted to prioritize that. And then I thought it was very important as well to highlight iron intake to be added, because that can really contribute to the fatigue and low energy feeling that she's experiencing. Like I said before, it's really important to gradually lean into this diet. Just slowly making progress is really important. There will be barriers like the patient's feelings towards food. Obviously, she has experienced struggles with food and eating, so it's really important to make her feel comfortable. And factors like their environment and socially and psychologically really come into play, especially with a patient that is underweight, over exercising, history of eating disorder, the environment, where they were grown up in, their family, the people that they're around. 15 is right in middle school, high school, so it's really can be a hard time for them, especially she is experiencing depression and emotional side effects. So it's really important to not only take care of the food part, but also take care of the mind part and mental, because mental is everything. And then socially, where they're at during the day, accessibility to food, all those things come into play. So I think it's really important to highlight those, and that will lead to the best results for the patient. Thank you.